Today, I'm going to take you through 5 movements that are safe and appropriate for the first trimester of pregnancy. My name is Morgan. I'm a master instructor with Stick Mobility, and I'm also pre- and postnatal certified through multiple organizations. Today's session is all about preparing your body for the physiological changes that are to come through pregnancy and as a stress-free way of moving your body, because I know it is very difficult to even show up for a workout, especially in the first trimester. So we're going to use all 3 of your sticks today, and we'll start with the short stick and we'll work on some breathing. The breathing is going to be your most used core exercise throughout your pregnancy. This is going to help you manage inter-abdominal pressure. That is going to change the way that you stand and the way that your body moves. So let's learn how to control some of that pressure with breathing. So we're going to start in a horse stance, wider than shoulder width. You're going to sink those hips straight down by bending those knees, and then you're going to place your short stick at 12 o'clock right in front of you. Now we are going to drive the stick into the floor as you exhale. That is going to engage the frontal line of the body. The frontal line is a fascial line that helps engage the abdominals, basically just helps the core stay as one. So as we engage the frontal line, we are also going to be engaging the pelvic floor. So we're working the breathing and the abdominals. We are working the deep frontal line, the fascial line that goes down in front of the body, and the pelvic floor. These are all going to be key throughout your pregnancy. So we're going to be doing this in a simple way so that you can feel it. You don't need to memorize all of these terms. So from that horse stance, stick is at 12 o'clock. We're just going to drive the stick into the floor. And as you do that, you're going to exhale. Now let's take an inhale and release that tension. So I'm going to show you from the side what happens when you inhale is you're going to expand front, sides, and back of your torso. Then as you exhale and drive that stick back into the ground, you're going to contract front, sides, and back. So let's do that again. Inhale, release the tension. And exhale, drive into the floor with that stick, squeezing front, sides, and back. Let's do that 3 more times. Inhale, expand, release the tension. And exhale, drive into the floor. Feel that tension all through the abdominals and even the posterior obliques behind you and those obliques on your side. Let's slowly inhale. And exhale, squeeze, drive that stick into the floor. Try to hold that exhale and that tension in the core at the very end of that exhalation. Inhale, release the tension and expand. And exhale, drive into the floor. We're going to do this 3 more times. Now this time, as you exhale, I also want you to think about lifting the pelvic floor as if it's an elevator. So inhale, release the tension. Exhale, drive down, squeeze the abdominals. Try to lift that pelvic floor. Hold. 2 more. Inhale. Exhale. 1 more time. Inhale. And exhale. Now release that tension and slowly come out of it. So don't worry, we'll get to practice that over and over throughout this session, and you can come back and repeat this session over and over again throughout the entire pregnancy. It doesn't just have to be the first trimester. So let's move on to our long sticks. We're going to find this deep front line, our pelvic floor, and those breathing mechanics with the abdominal tension in a hang position. So now we're going to go into a tall standing position with the sticks at 11 and 1 o'clock, just a few inches in front of those toes. Then you're going to reach up towards the top of the sticks. And then you're going to shift your weight forward onto the stick. So I'm letting the chest drop forward slightly. The knees are bending and then the hips are shifting back ever so slightly. So I'm just giving my body weight to the sticks here. Let's take a few breaths here. I'll show you from this angle. A few breaths here so we can get back into that belly breathing. So go ahead and inhale. Really hang on the sticks as you inhale. And then as you exhale, think of that abdominal tension, squeezing the air out of those lungs and lifting that pelvic floor. Let's do 2 more. Inhale, expand, and exhale, squeeze. And let's go one more time. Inhale, expand, and exhale, squeeze. Now your grip may start to get tired during this, and that's okay. Just reset and get back into that hang. We're gonna hang here for a little bit longer. So let's take another inhale. And as you exhale, lift those heels straight off the floor. So now we're gonna work into some ankle movement, but continue that hang and that nice deep breathing. As you inhale, slowly lower the heels back down. And exhale, lift those heels up. Doesn't have to be super high. We're just shifting the weight onto the toes. And then inhale to come back down. And exhale, squeeze and lift. And inhale down. And exhale, squeeze and lift. Let's do 4 more. Inhale down. Exhale, lift. Last 3, inhale down. And exhale. If the feet and ankles are starting to get tired, or if this is really difficult to lift these heels, just hold that monkey hang and take a few more breaths. And exhale. Now this last one, we're gonna hold for a little bit longer. So inhale those heels down. Exhale the heels up. Now we're going to take 5 more breaths here. So we're going to inhale, exhale, inhale, exhale, inhale, exhale. Last 2, inhale, exhale. Last 1, inhale. And exhale, bring those heels down slow and slowly come out of it. Let's give the upper body a little bit of a rest, those feet and ankles a rest, and we're gonna come down to the floor. So come down safely and slowly, and we'll be in a shin box position. So the front leg is gonna be externally rotated. The foot is going to attach to the front of the back thigh. So we're going to start with our left leg in front. That left foot is going to be close to that right thigh. The right leg is the trail leg and it's internally rotated. So we're working the rotation of our hips, but we're also going to be starting to work getting onto and off of the floor, which is going to be really important for parenthood, but also as you progress through your pregnancy, it's going to be more difficult to get up and down. So we want to prepare those joints for what's to come. So from this shin box position, we still have our long sticks. We're going to reach those sticks in front of that left shin at 11 and 1 o'clock. Now a regression from this, if this is really difficult to hold this shin box position, you can prop this back hip on a yoga block or a small step stool and work from there, and slowly over time you'll be able to work yourself down to the floor. And another regression, if the shin box is fine but it's hard to get up onto your shins, which I'm about to show, you can reach those sticks on either side of that left knee, okay? So find the progression that works best for you, and we'll do a few of these so you can just figure out what that sweet spot is. So the sticks are at 11 and 1. And you're going to sort of lean forward so you're in that almost hang position again. Now you don't want the sticks to be leaning towards you here. If anything, we want the sticks to be leaning away just slightly. Okay, that's going to help us feel our deep front line as we come up onto the shins. As you exhale, you're going to push down into the floor with the sticks. You're going to lift the pelvic floor, squeeze the abdominals, and come up onto the shins. At the top, you want those glutes to be squeezing. So go ahead and come on up onto those shins. Keep holding those sticks and driving them into the floor. Right here, I'll feel my deep front line working, pelvic floor lifting. And then inhale to reach those hips back down to the floor. Right? So we're hanging at the bottom, and then exhale to come back up. At the top, I want you to imagine you're trying to squeeze the floor together between those two knees. Then inhale to slowly come back down. Let's do 4 more just like that. Exhale, squeezing that floor. You're pulling yourself up. Hold. Inhale. Last 3. Exhale. Feel those glutes squeezing tight. Inhale. And last 2. Hold. Inhale to come down. Last time, exhale, lift the pelvic floor, drive those sticks into the floor, hold, and slowly inhale to lower. Let's switch sides. So now the right leg is going to be in front, left leg is the trail leg. Sticks are at 11 and 1 o'clock, right in front of that right shin, or inside, outside that knee, or you're propped up on a small surface like a yoga block. Lean forward onto those sticks. Then you're going to drive the sticks into the floor. Exhale, pull up, hold, and then inhale to lower those hips back down. Exhale to come on up, and then inhale, slowly lower those hips back. And exhale to come on up, and inhale to come back down. Last 3, exhale, up, inhale, down, exhale, hold, inhale, down, and one more time, exhale, pull yourself up, drive those sticks into the floor, feel those glutes squeezing and those knees squeezing towards each other, and slowly lower those hips. All right, let's give those hips a little bit of a rest, but we are going to continue with the lower body focus. We're going to grab our short stick again. Now we're going to work a lunge. So we're going to start from the top down, and then we'll work from the bottom up if you feel like you can progress this. One thing to know about pregnancy is the hormone relaxin. Relaxin relaxes your joints. So as you progress through pregnancy, you may feel some joint pain, joint weakness, and or increased range of motion. We don't want to work in too large ranges of motion during pregnancy because with increased range of motion comes instability. So when we're working these lunges, if you feel any pelvic floor pain or joint pain in your hips, or the sacroiliac joint, which is right at the base of your glutes, right at the base of your tailbone here, then do everything on 2 feet. So we don't want to do split stance or single leg movements if we're feeling instability or pain. Relaxin, unfortunately, is going to stay with you even through a few months postpartum. So we want to be able to strengthen the joints in their increased ranges of motion. Relaxin is helpful because it helps you deliver the baby, but it does also come with some aches and pains. So with that said, let's get into our lunges. So again, we're working that deep front line, and we're working on strengthening the joints in this position. So feet, ankles, toes, hips, knees. All right, so let's start with the left leg in front, right leg is back, and we're gonna do a static lunge. So we're gonna keep those feet planted the entire time. The right heel is going to be up behind you, and we want this left foot to be solid into the ground. Try not to make this lunge position too big, because as I was just talking about, we want to work within a moderate range of motion. So the stick is going to go at 12 o'clock, and you're going to press the right hand on top. So whichever leg is back, which my right leg is back, right hand's going to be on top. We're going to drive that stick into the floor at 40% tension. Keep that tension there, and we're going to slowly lower into your lunge and hold. As you're in this lunge position, try not to lean too much weight forward. We want the weight evenly distributed between both legs. and slowly come back up. Let's do 2 more just like that. Now increase the tension on the stick to 50% of your max effort. Hold that tension as you slowly go down. And then we're going to exhale to come back up. Let's do 1 more time from the top down. Increase that tension to 60%. Take an inhale down. And an exhale to come back up. If that was very difficult, stay with that progression. If that was easy-ish, we're gonna progress to bottoms up. So you're gonna go down onto that right knee fully, slide those hands down just a little bit, inhale on the ground. If you're standing, you'll inhale down and exhale, lift. Now we're lifting into that lunge and hold. Inhale down, hold, exhale. Keep that 60% tension on the stick. We really want to find that deep front line and pelvic floor. Inhale down, hold, and we're going to do that 1 more time. Exhale, up and hold. Slowly lower out of that position and let's switch sides. So now I'm going to go with my right leg forward, and you can choose either to do all of this set with your preferred progression, or you can split it 3 and 3 again. So left hand's going to be on top. Let's start at 40% tension, driving down into the floor. And we're going to inhale, hold, and exhale, up. Inhale, hold, exhale, hold. Increasing this time to 60% tension. Inhale, hold, and exhale, hold. If you would like to progress that, come on down to the floor. Inhale, hold, exhale, hold. Inhale, hold, exhale, hold. 1 more time. Inhale, hold, and exhale, hold. And slowly release out of that position. Let's finish today's session with some nice deep stretching. We're going to do our ninja flow. So we'll grab 1 long stick. We'll go into a wide stance, wider than shoulder width, even a little wider than that horse stance we started with. Toes are pointing straight ahead. We're going to stretch into the hips, the spine, the shoulders, the neck, getting everything stretched out. So the stick is going to go inside the right foot, just an inch or 2. You're going to grab the stick at eye level or forehead height. Hinge at those hips, soften the knees, and let that left arm hang down. Now without shifting the hips, you're going to reach across the stick, across the body, grabbing the stick, thumb facing down. We're going to pull the stick apart at 30% tension and shift to your left. This is going to help rotate the spine. We're going to keep pushing that left knee out to the side. Again, not working into full range of motion, just something that you can easily manage. And let's shift to the right. As you exhale again, pull that stick apart, shift back to the left. And shift to the right. Let's go 1 more time. Pull the stick apart, shift to the left. Finding rotation of that spine. Nice deep shoulder stretch. And shift to the right. Let's slowly release the left hand, soften both knees, come on up, and we're going to switch sides. So now the stick is going to go inside that left foot, again, grabbing at eye level or forehead height. We're going to hinge at those hips, soften the knees, let the right arm fall, and then reach across with the right arm, thumb pointing down. Pull that stick apart at 30% tension, and then shift to the right. Bending that right knee, straightening the left, looking up towards the ceiling, hold. And let's shift to the left. Keep breathing here. There's no set breathing for this one. Just try to breathe throughout, keeping those same points in mind that we've been working all session. Engaging the abdominals to exhale, lifting that pelvic floor, feeling that deep front line of the body. To the left. Let's go one more time. Pull the stick apart. 30% tension. And shift to the right. Hold. Breathe. And shift to the left. And then let's slowly come on out of it. Very nice job. I'm so proud of you for getting this workout in today. As I said, I know it's difficult in the first trimester. You're doing great, and I'll see you next time.